Today, we have invited Dr. Arpit Jain with us. Dr. Arpit Jain is a very senior physician. He is the head of Department of Internal Medicine of Artemis Hospital. Artemis Hospital is one of the largest super specialty hospitals of Delhi NCR, located in Gurugram. Dr. Arpit Jain has done a lot of work in diabetes management. He is also a member of Research Society for Studies of Diabetes in India. So we welcome Dr. Arpit Jain today, sir. It's an honor and a pleasure to have you here with us as a speaker.
Thank you, Dr. Aman. Thank you very much for the introduction and giving me this opportunity. Good evening, everybody. I am Dr. Arpit Jain. So first of all, what is the diabetes? So everybody know in a layman language what is diabetes. Whenever there is increase in blood sugar levels in our body, it is diabetes. This is how a layman understands about the diabetes. So basically, it is inability of our body to properly control the blood sugar levels in our blood and body. That is diabetes. So how it happens? Basically, blood sugar levels in our blood and body are controlled by a hormone, which all we know that is insulin. So insulin regulates our blood sugar levels and it controls the overall metabolism of the blood sugar and glucose. So what is insulin? Basically, insulin is a hormone which is secreted by beta cells of the pancreas. So in diabetes, one of the mechanisms is that beta cells of our pancreas start failing. That's why there is decreased level of insulin in our body. And because of this, our body cannot take care of the. So how insulin controls the blood sugar level? Basically, whenever we eat something, our food items ultimately break down into glucose. This glucose gets absorbed from our intestines and get into our bloodstream. And from bloodstream, ideally and normally, this glucose should go into our body cells. Basically, our body cells utilize glucose as a fuel. So how it goes into our cells? So insulin acts as a key. It opens that lock, and then these glucose particles enter our body cells. And body cells utilize it as a fuel. That is a source of energy to our body. But if we don't have insulin, we cannot unlock this lock. And this blood sugar will remain, in our blood, and level of sugars in our blood increase. That causes a lot of complication. So complication is in two ways. One thing is our cells are not getting energy in form of glucose, and the glucose is staying back in blood, increasing the sugar level in the blood. So it is causing problems in two ways. So that is one way of how diabetes is, blood glucose levels goes up in the body. Second mechanism is we have insulin in our body, but this insulin is not effective. This is called insulin resistance. So we can say that we have the key, but key is unable to open this lock. This is called insulin resistance. So these are the two main mechanisms of diabetes. So now we know how diabetes basically it happens in the body, but what are the symptoms? So generally we say, what are the cardinal symptoms? There are three cardinal symptoms. Cardinal means main symptoms. We don't see all these symptoms in everybody, but these are the main symptoms. If combination of these three symptoms are there, we can be very much sure that patient is suffering from diabetes. These symptoms are excessive thirst, excessive hunger, and frequent urination. If there is combination of these three symptoms, more or less we can be sure that patient is suffering from diabetes. But because most of the cases we found during routine examinations, we are doing routine blood sugar examination. I mean, for any disease patient is coming to the hospital, and as a routine we write a blood sugar test. So it could be detected during that period, or patient is undergoing some surgery, we do a routine test, patient is undergoing a preventive health checkup during that period. So asymptomatic patient. So no symptom is the most common symptom of diabetes. But otherwise, common symptoms, as I told you, majorly ज्यादा प्यास लगना, बहुत ज्यादा भूख लगना, बार बार यूरिन आना, ये सबसे कॉमन तीन सिम्टम्स हैं. इसके अलावा patient can have weight loss or weight gain, he can have weakness or fatigue. Sometimes there could be nausea, dizziness, blood vision, frequent infections. Another very common symptom is frequent infection, frequent urinary infection in ladies, frequent vaginal infections, or delayed healing of the wounds. Non-healing wounds, delayed healing wounds. These are the very common symptoms. Now we know the symptoms. After that, now who are the people who are more prone for diabetes? When we talk about these more prone people, generally we are talking about type 2 diabetes, which is the most common diabetes. So generally people with excessive body weight, overweight people or obese people, people with age more than 40 or 45, with a family history, because in type 2 diabetes, family history plays a very important role. Around 30 to 40% patients with type 2 diabetes mellitus have family history of diabetes, or either their parents, grandparents, or some siblings are suffering from diabetes. Definition of overweight and obese, criteria for that in South Asian population or Asia Pacific population is lesser than the Western population. We are more prone for diabetes, and we are more prone for diabetes at lesser body weight. People with other lifestyle disorders, they are also more prone for diabetes. So when I talk about lifestyle disorder, what are the lifestyle disorders? These are diabetes, hypertension, cholesterol problems like high cholesterol levels, heart disease. These are also known as lifestyle disorders, because these diseases can be managed with our lifestyle modifications, and these are more prone on people with bad lifestyle. So these people, I mean, all these lifestyle disorders are interlinked. People with diabetes have more incidence of hypertension, more incidence of heart disease, more incidence of high cholesterol, and similarly, people with hypertension or high cholesterol have more incidence of diabetes. So now come to what are the different types of diabetes. One is type 1, other is type 2. And there are some other kinds of diabetes. So briefly about type 1 diabetes. Most of you know that type 1 diabetes is basically diabetes in younger age population, in children or young population. And previously it used to be known as insulin dependent diabetes also, because the treatment for this kind of diabetes is only insulin. In type 1 diabetes, medicines don't work. So how type 1 diabetes happens? Basically, risk factors and mechanism of diabetes is slightly different in both diabetes. Here, obesity and lifestyle problems doesn't play much role. It is because of pancreas is failing because of some antibodies acting against the pancreas, our own antibodies against our own cells. So it's a kind of autoimmune disease. So because of that, pancreas is unable to produce insulin, and that's why our body cannot take care of the blood sugar levels. Then is type 2 diabetes, which is also known as previously used to be known as non-insulin dependent diabetes mellitus. Why it is called non-insulin dependent? Because this kind of diabetes can be managed with lifestyle management like diet and exercise and lifestyle modifications with certain medicines. But in certain cases, it may require insulin. And there are certain people in which lifestyle modifications and medicine alone may not work, and we may require insulin in these patients, but that does not make these patients as insulin dependent, because at the initial stage, these patients can be managed without insulin also. So by definition, even if they require insulin, they will not be classified as insulin dependent. So as I told you earlier, type 2 diabetes mellitus, there is very high incidence of family history. So there is very important genetic factor. And there are environmental factors like people indulging in high calorie diet, who have limited physical activity. Like these days, many people have sedentary life, no exercise, all the time on mobile or laptops or TV. So our lifestyle has become like that physical activities in the younger population is very less these days. So that's why we see even in younger population, these days we are seeing cases of type 2 diabetes mellitus. Earlier, we used to see diabetes mellitus in age group about 40, but now we used to see type 2 diabetes mellitus sometimes even in younger population, like at the age of 15 or 20 also, because of the obesity, lifestyle. Even young children are obese. They have hardly any activity. So if they have family history, they are becoming diabetes at very young age. And in that case, it is not type 1 diabetes, it is type 2 diabetes, even in younger population. So that briefly, I will tell you the differences between type 1 and type 2. Type 1 diabetes generally appears acutely or within short span. Type 2 is a chronic, as Dr. Aman said, it's a chronic disease. It starts slowly. Type 2 is more common type of diabetes. In 85 to 95% population, it is type 2, whereas only 5 to 10% is type 1. Type 1 is in younger population. Older, more than 40, it is type 2. But for type 2, it is not, as I said, even younger population can have type 2 diabetes. There are certain racial differences, like South Asian population and certain African people of African descent, they have more prone for type 2 diabetes. Defect, as I told you, it is type 1 is an autoimmune disease with absolute insulin deficiency. And in type 2, it is both insulin deficiency as well as insulin resistance. Type 1 patients are generally lean and thin patients, and type 2 are generally overweight and obese. Family history, as I told, in type 2, it is very significant. And treatment wise, again, I discussed it earlier. In type 1, it is only insulin. In type 2, multiple things, starting from lifestyle to insulin. Typical symptoms I already discussed. Now, how to diagnose diabetes? We do certain blood tests. One is fasting plasma glucose. Another is postprandial. Postprandial means after meals, 2 hours after meals. Or to be more precise, we can do a glucose tolerance test, because it becomes a standardized test for everybody. I mean, a meal could be different for different people. Everybody can have a different kind of meal with different number of calories. But if we give a standard 75 gram glucose, it is standardized for everybody. So that is a standard for diagnostic that takes as a gold standard. We give a 75 gram glucose in a water solution, and after 2 hours of that, we take another sample. So fasting sugar, I should say plasma glucose, if it is more than or equal to 126, it is defined as diabetes. And post 75 gram glucose, 2 hours of 75 gram glucose, if it is more than 200, it is defined as diabetes. If it is between, fasting is between 100 to 120, then it is known as pre-diabetes. We have another very important test, very frequently used these days, is HbA1c, or called glycated hemoglobin. Basically, this gives a 3 months average. This is another diagnostic test as well as for the management. If its levels are more than 6.5, it is defined as diabetes. Now onwards, mostly I will be talking about type 2 diabetes. Whatever we are talking now about management is mostly to in relation to the type 2 diabetes. So how to manage? So first and foremost thing is lifestyle management, because it is one of the lifestyle disorder. So lifestyle management is the most important thing. So when we say lifestyle management, what is the meaning of that? It means our diet, our activity, our other habits. So we have to control our diet. It should be controlled, restricted caloric diet as per our body weight, as per our BMI. I'll talk about BMI later. So we should decide about the calorie. That could be different for calorie intake, could be different for different individuals. A dietitian or your doctor can tell you how much calories you require. So according to that, you have to plan your meal. Grossly, we should cut down on all kinds of free sugars. All kinds of free sugar we should cut down. It could be sugar, fruit juices, your sweets, chocolates, all these things should be cut down from your diet. Then high fat things with food items with high fat content, those should also be restricted in your diet. No deep fried things, no ghee, butter, all these things should be avoided in diet. After diet is exercise. Another very important aspect, this slowly we are lacking in exercise. Then is another important thing is diabetes monitoring. We should monitor our diabetes. Ideally, anybody with diabetes should have a monitoring equipment like glucometer at his place, and he should routinely monitor his blood sugar levels. And then is the pharmacological intervention. Pharmacological intervention could be in the form of tablets, it could be form of insulins, because in type 2, initially we start with tablets and later on in certain patients, we may require insulin. So again, follow a healthy meal plan, do regular exercise, and monitor sugars and take your medications regular. That is another important aspect, compliance with your medicines. So for monitoring, every diabetic should have a glucometer at home. So I hope most of you know how to use a glucometer, and you must be monitoring your sugar with a glucometer, but that is a very important aspect of overall diabetes management. So this we call as
Sir, please show the chart for normal glucose level.
Achha, okay, I'll go there. This one, yeah. So normal is, I'll read it out for you. Normal is fasting plasma glucose up to 100 is between 70 to 100 is considered as normal. If fasting is more than 100 and up to 125, we call it as impaired fasting glucose or pre-diabetes. If it is 126 or more than 126, it is defined as diabetes. And post 2 hours, post meal or post 75 gram glucose, 2 hours of post 75 gram glucose. Normal is up to 140. 140 to 200 is impaired glucose tolerance, or again, it could be called as pre-diabetes. More than 200 is diabetes. Similarly, if you have facility of HbA1c, HbA1c up to 5.7 is considered normal. 5.7 to 6.5 is pre-diabetes, and more than 6.5 is diabetes. Diabetes is a silent killer. As I told you, it's a silent killer because most of the time in type 2 diabetes patients, it could be asymptomatic. It could be asymptomatic disease without any symptoms. But whatever little symptoms you have, you may take that as part of your daily life. कि ठीक है, तो इतना तो थक जाता हूँ, तो मेरी उम्र हो गई है, कुछ भी, whatever you call it. But you may ignore some early warning signs as a part of your routine life. आप ऐसा सोच सकते हैं. So that's why it is also known as silent killer. Because अंदर वो body को खराब कर रहा है. बाहर से आपको कुछ महसूस नहीं हो रहा है, but it is affecting your organs. It is affecting your blood vessels. It is affecting your nerves. It is affecting blood supply to your heart, blood supply to your kidneys, blood supply to your nerves by the direct effect of high blood sugar and indirectly affecting our blood vessels. That's because of that, decreasing blood supply to the essential organs and other body parts. So it can lead to diabetic foot. It can lead to gangrene of the foot, infection of the foot. So it is known as diabetic foot. So diabetes is one of the very common causes of loss of limbs, amputation. It's very important because of uncontrolled diabetes. It can lead to diabetic foot and amputation, one of the most common cause of amputation. Similarly, diabetes is one of the most common cause of old age blindness because of diabetic retinopathy. Diabetes affects our retina. It is known as diabetic retinopathy. And if it is not controlled timely and it progressed, it can lead to blindness. Then other important thing is involvement of the kidneys, what is known as diabetic nephropathy. As sir is saying, slowly and slowly our kidneys starts failing. Initially, there could be some protein in the urine. That could be the initial sign, protein in the urine. But later on, there could be kidney failure. Then it can affect our heart, leads to heart attacks. It can lead to strokes. So these are the main complications of diabetes. So when we talk about all these complications in management, one very important aspect is foot care. And I would say it is the most neglected part of diabetes management. Foot care. We take care of everything. We take care of our blood sugar, cholesterol, blood pressure. We see so many things. But we forget to look at our feet. Most neglected part of diabetes management. Even, I will not say only patients, even at the level of physicians, sometimes it is the most neglected part. So we have to be very careful about care of our feet. Every diabetic should inspect and examine his feet at least once in a day. If not more than that, at least once in a day, we should have a look at our feet. कहीं पर कोई चोट तो नहीं लगी है, कोई क्रैक तो नहीं है, कोई कॉर्न तो नहीं बना हुआ है, कैलोसिटीज बन जाते हैं, हार्ड pressure, particularly at pressure point, there could be hard areas, which is known as callosities. कोई callosity तो नहीं बनी हुई है, कोई ulcer तो नहीं है. We should see all these things. Other important areas between the toes. Between the toes is a more very important area of getting infections. We can have bacterial infections there. We can have fungal infections there. So we should examine areas between our toes, this cleft between our toes. Whenever we come back from outdoor, we should try to properly wash our feet and then wipe with a dry cloth, including area between our toes. It's very important because otherwise we wipe out everything from the foot and there is moisture remains there in between the toes, and that can lead to infections. So that is also very important. So foot care is important. If there is, and then other than inspection, what else we can do to prevent diabetic foot and foot related problem in diabetes? We should not walk barefoot. Even inside our house, we should not walk barefoot. One reason is we expose ourselves to environmental, different environmental things which can lead to infections. Other thing is we can injure our foot, which even a small cut can lead to dangerous infection. Other thing is diabetic patients have what we call as diabetic neuropathy, whereas our nerves which carry sensations becomes damaged. Because of that, our ability to perceive pain or temperature becomes numb, or sometimes we lose that sensation. So we don't feel, if something pricked into our foot, we may not perceive that. We may burn our feet because we don't perceive the temperature difference. So we can burn our feet, and which can lead again to infection and diabetic foot. So we should not walk around barefoot. Then what kind of footwear we should wear? It should not be tight, or from forefoot should be slightly broad, where it should not squeeze your toes. You should, because if it's a tight from front, squeezing your toes, again it can lead to damage to your foot and injuries. So then for other things like retinopathy, nephropathy, ultimately it is good control of diet, diabetes and blood pressure, sugar and blood pressure and cholesterol. If we control all these things, we can at least delay the onset of these complications, or if these complications are there, we can at least delay their progression. So what is the cost of mismanaging the diabetes or ignoring the diabetes symptoms or diabetes care? We are 25 times more prone for retinopathy, or which can lead to blindness. We are 20 times more prone for amputations. As I discussed, it is one of the most common cause of lower limb amputation. We are 6 times more prone for strokes, and we are prone for heart disease also. So you must have seen most of the patients who have heart attacks, who have stroke, most of these patients have history of diabetes also. And similarly, kidney failure, one of the very important causes for kidney failure is diabetes. Now is BMI. Because people with obesity or high BMI are more prone for diabetes and different other metabolic complications. So what you must be knowing what is BMI. It is a ratio of our, it's a kind of ratio between our height and body weight. So if BMI is more than 30, we define it as obesity. Now in Asia Pacific region, this definition is 25. So people with high BMI are more prone for all these complications. They are more prone for diabetes. Then even in obesity, it depends upon the fat distribution also. Where is the fat? Some people are obese, but they have equal distribution of fat. But people with more fat in abdomen, they are more prone for diabetes. So abdominal obesity is more important than normal obesity. So to measure abdominal obesity, we have certain criteria like waist circumference or waist hip ratio. If these are abnormal, they are more prone for obesity. So they are more prone for diabetes. Can we prevent diabetes? Yes, we can prevent diabetes. We can prevent normal people from going to pre-diabetes and pre-diabetic people from going to diabetes by different lifestyle modification, as we discussed, diet, exercise, all these things.
You see, are certain things which Dr. Arpit Jain has said are very, very important. Like मॉनिटरिंग ऑफ ग्लूकोज, ब्लड शुगर, ग्लूकोमीटर। जैसे सर ने बताया, डॉक्टर अर्पित जैन ने बताया कि रेगुलर मॉनिटरिंग इज अ वेरी वेरी इंपॉर्टेंट थिंग। ये नहीं कहना चाहिए कि आज मैंने 3 महीने पहले किया था, मेरी शुगर ठीक थी तो मेरी आज भी ठीक हुई। दिस इज अ वेरी वेरी इंपॉर्टेंट पॉइंट। दूसरा जो डॉक्टर ने बताया कि रेगुलर चेकअप विद डॉक्टर, दिस अगेन इज वेरी इंपॉर्टेंट। ये नहीं कहना चाहिए मेरी शुगर ठीक चल रही है, सब ठीक चल रहा है, मुझे कोई सिम्टम नहीं है, मुझे कोई बीमारी नहीं है, मैं ठीक चल रहा हूँ। लाइक व्हाट ही सेड, डायबिटीज इज अ साइलेंट किलर। सो रेगुलर चेक, चाहे 2 महीने में एक बारी, 3 महीने में एक बारी, वो बहुत जरूरी है। वन हैज टू गो टू अ डॉक्टर, टू योर डॉक्टर whoever you are discussing or consulting. You should go and talk to the doctor regularly. तीसरी चीज जो डॉक्टर मैं नोट्स बना रहा था, तीसरी चीज उन्होंने कही थी कि नॉट टू स्टॉप ट्रीटमेंट और चेंज ट्रीटमेंट ऑन योर ओन। दिस इज अगेन वेरी इंपॉर्टेंट। ये नहीं कहना कि जी मुझे लग रहा है कि मेरी ठीक तबीयत लग रही है, मुझे कोई परेशानी नहीं है तो मैं दवाई बंद कर दूं अपने आप। ये कभी भी नहीं करना, बिकॉज एज अगेन ही सेड इट्स अ साइलेंट किलर। it can start damaging your body inside. You may not even come to know about it. Also, one more thing is that there are times when readjustment of doses is required. कोई जो दवाई चल रही होती है, कई बारी देखा गया है कि उसकी डोजेस इंक्रीज या डिक्रीज करनी पड़ती हैं, और वो हमें तब तक नहीं पता लगेगा जब तक हम रेगुलर अपना चेकअप ना कराते रहें और रेगुलर अपने डॉक्टर से ना मिलते रहें। बिकॉज लाइक वन ऑफ यू हैड सेड कि किडनीज में हल्का इफेक्ट आ रहा है, डॉक्टर साहब ने कहा कि आपकी डोज को चेंज करना पड़ेगा। टाइट्रेशन, इसको हम टाइट्रेशन ऑफ डोज कहते हैं या एडजस्टमेंट ऑफ डोज कहते हैं, सो दैट इट डज नॉट इफेक्ट योर other organs of the body, as well as it maintains your blood sugar level. Over a period of time बॉडी में रेजिस्टेंस भी बढ़ सकती है, बॉडी में चेंजेस भी आ जाते हैं, तो हमें डोजेस चेंज करनी पड़ सकती हैं। जब तक हम रेगुलर टेस्ट नहीं कराएंगे, जब तक हम डॉक्टर को नहीं मिलेंगे, तब तक हमारे को नहीं पता चलेगा कि हमने कब एडजस्ट करनी है और कब अपनी डोज चेंज करनी है या दवाई एज अ मैटर ऑफ फैक्ट चेंज करनी है। These are certain very very important things which Dr. Jain has said today. And one more thing which I had noted was जो कि हम लोगों को, कईयों को नहीं पता। हमको पता है किडनी प्रॉब्लम होती है, हमें पता है हार्ट अटैक होता है, हमें पता है स्ट्रोक होता है। फुट केयर, पैरों पे जो इफेक्ट आता है डायबिटीज का, it can lead to gangrene, it can lead to amputation. We have to be very 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 careful about that. These are certain things, Dr. Jain, I had made notes जब आप बोल रहे थे, जब आप बता रहे थे। So these are the takeaway points today, that we have to make sure कि हमारी जो points हमने बताए हैं ये हमारे माइंड में रहे। डायबिटीज तो जाएगा नहीं, it's a chronic disease which is going to remain with us. So we have to make sure of these things, that we do not neglect this. And what again is important is a regular full body checkup, comprehensive checkup, which time and again I have said in my previous meetings also, in my previous webinars also, that checkup of your body is very very important. Don't wait for yourself to fall sick. Get it done regularly. Consult with your doctor.